Okay, now we have speed. I was just telling Dr. Glenn, we only have one camera this week, so you're going to only be able to see his beautiful face as we talk. But
Stop.
handsome, I meant handsome. What were you saying?
Oh, I just wanted to ask you how are you doing?
How am I doing?
Yeah.
I'm doing okay.
Good.
I'm doing well. I don't think I formally introduced myself last time. My name is Cameron Glenn.
Cam's my big brother, guys.
Yeah.
So Cam's 6 years older than I am. 6 years wiser.
It's actually 5.5, but yeah.
5.5. Okay, you're right.
Yeah.
So yeah, Cam is also he's investigating testosterone replacement as well. We've done some testing, we've got some low levels, and so all these questions that come up are actually like really relevant to him and his future and stuff like that. Just let's see, as of a couple months ago, you turned 49 years old.
Staring at 50.
Right in the thick of middle age, starting to experience a lot of those middle-aged symptoms, maybe some of the, I don't like the term senescence like that, because I think that's, but hormone decline, I guess you could say.
Yeah.
And some of the expected symptoms from that as well. But definitely like low levels, right? What was your testosterone level?
I think I measured at like 200.
200.
200 is what it was. Yeah.
So the reference range, depending on what lab you're looking at, ends around usually around 250.
Mm-hmm.
So I've seen some as low as 220, but definitely testing low.
Right.
And so, what kind of symptoms are you experiencing from that?
I am. Excuse me. I think a little bit of brain fog. I don't sleep very well, in the sense like I don't feel like ready to go to sleep at night sometimes, and that could be partially my caffeine intake as well and the timing of that. But having the presence of mind, or like the vigor in my head to be like, I'm going to go out and do this right now. I think that's a little bit of a challenge. I do like going to the gym. I do like working out. I mean, that's part of my daily routine, so I don't really struggle with that. Just like anybody else, sometimes it's tough to get out the door, but I would say regarding that, definitely seeing the gains, and not, putting the work in and not seeing the gains that I'm used to seeing. Mm-hmm. Although I only started working out like in earnest in the last year and a half. So,
but year and a half, have you not seen,
yeah.
and you feel like in a year and a half of working out, you haven't seen much changes?
I've definitely put on muscle, but I've also put on fat. I think losing weight has also been a challenge.
Yeah.
I'll walk for maybe like an hour and a half a day, or I'll be on the treadmill for 45 minutes, and I don't feel like I lose much weight.
So body composition.
Yeah, I think that's it. Definitely. I'm not putting this very elegantly, but it's kind of a challenge because for a lot of years, as some of my friends know, I sat at a desk, I worked 10 hours a day in a newsroom, and I wasn't that active. Sometimes I would ride my bike to work before my youngest was born. And so I was kind of maintaining, I would say, maybe like 185 to 190. And I'm up to about just over 200 now. But I have put on maybe 15 pounds of weight. But I do want to have that additional muscle look good, right?
Yeah,
I want to be able to see that definition and more than anything, feel good about like my health in the future.
Okay.
But I'm doing the most good for my body, I guess you could say.
Yeah. Yeah. So. Okay, good. I think you would, you already know how I feel about it. You need to supplement.
Right. Right.
But even if you were like, 300, I'd probably say, you need to consider supplementation. Just because of the benefits. And now, it's funny, I want to dig into that a little bit more. You talked about like the motivation to get up and go and do like procrastination almost.
A little bit. I like working out. I like doing that, but I just feel like as I'm ready to go out the door finding things popping into my mind like, oh, I've got to do this, or while I'm out, I really need to do this and that. And it's not necessarily because I don't like doing it. For some reason, there's something in the back of my head that's kind of putting it. It's work, right?
Right.
You know,
it's okay. Yeah. But it's like it's like inertia. It's like this feeling of lack of inertia to get things done.
Yeah.
I think I can understand that.
I also need to put a little bit more thought into the amount of weight that I lift. I've been kind of doing the same program for about a year and a half and just kind of assuming that that's going to be the best for me. So maybe re-energizing it with a little bit of a different.
So you kind of done
routine.
the same exercises for that all that time.
Right.
Like the same split and all that.
Yep.
What is your, like, do you lift when you're doing a set, do you lift until like you can't do another rep?
I do. Mm-hmm.
So you lift to failure like every time.
Yeah. And I'll push myself some weeks, depending on how I feel, I'll maybe do like 85% of max, but then I think on the top end, I'll do like 90%. I'm not trying to show off here. I'll tell you what I think my max is probably about 150 pounds if I'm doing like
a bench press.
No, like dumbbell press, right?
Okay. Yeah.
About 150 pounds. And I go as many reps as I can.
So like
not as many reps
75
as I can.
in each hand.
Exactly.
Okay.
Right. My goal is 10, but most days I can do like 2 sets of 10 and then like 1 set of like 6 or 5.
So if you were like, okay, I'm only gonna do 5 reps, do you think you could lift like 100-pound dumbbell? Could you physically lift it?
I don't know. I could try it. That makes me nervous. All of a sudden I just like got sweaty, like broke a sweat. Maybe it's because I'm thinking about it. Maybe it's because we got these new lights that are just fantastic, or the fact that I'd be challenging myself if I said yes, like I can do that. I'll try and do it because I'm the kind of person that's like, if I say I'm going to do it, I'm going to give it a shot.
So I noticed, like for years I lifted like with 12 as my goal. I'm going to pick a weight where I can do like 12 reps and
oh right.
Because one thing I remember when I was coached in bodybuilding is my coach was like, don't think about the weight, don't think about the number. Just think about your reps, like doing really good quality, reps and getting to that 8 to 12 number. Because at the time that was like the best, research. And it's pretty, for hypertrophy, that's sort of what you want to shoot for. In recent years, I'm like, I kind of like lifting heavy. I just like the feeling of it and like what it does to my body and stuff. Yeah. Get that heart rate up and stuff. So
sure.
I'm like a 5 to 8 guy now.
Oh, okay.
So, I'm hitting those 110, 115 dumbbells pretty routinely, like on an incline. I've done, like I think my gym goes up to 120 dumbbells. And sometimes I'll grab those too, but more like just to prove to myself that I can still lift them.
Oh, right.
But it's like maybe two good reps, and then I'm like, okay, that's enough of that.
Right. Yeah. Some of the time I just noticed that my form is starting to waver a little bit. Like the weight is starting to kind of move off in a direction that's like, well, this is not. It's this kind of it's not going to be as helpful as it could be otherwise.
Yeah. I was talking to my wife about this yesterday because she was talking about what she lifts and stuff. And I'm like, do you like, how many reps are you doing? Oh, she's like, I'm doing like 12 reps. I'm like, when you count to 12, do you then stop? Like yeah, like, okay. Right. But interesting video from Mike Isertel this week too, talking about like when they're training women, they're just constantly telling them one more rep because they're leaving like typically women are like leaving 5 reps in the tank. And you're just not going to get gains in hypertrophy that way. Mike preaches like this 1 rep reserve, like 1 to 2 reps in reserve. He doesn't think that you need to fail on every set to get maximum benefit based on some studies. But I think like it's hard for me if I'm thinking, I'm going to leave 1 rep in the tank, I'm probably going to leave like 2 reps or 3. So I have to start that last rep and be like, oh, nope.
Yeah, that's me too. Right, yeah, exactly.
This ain't happening.
Fail on the last rep. If I go lighter too, I'll do the same thing. If I do like 75%, I still go even if it's 20 reps, I just
Yeah.
go as far as I can.
So how many days a week? Like, what's your split like? How many days a week do you?
I have two kind of routines. I don't know all the lingo, but I have 2 days of upper body and then 2 days of lower body.
So it's like push pull.
Right. So I'll do routine A upper body and then routine A lower body. So Monday and then Tuesday's lower body, and then I have a rest day on Wednesday, and then the routine B of upper body and lower body on Thursday and Friday.
Okay.
And then
So
I usually
two separate leg days.
2 separate leg days. Yeah.
Good for you.
Yeah, on the first leg day, I do curls and leg extensions and maybe like kettle, like those dips or whatever.
Okay.
And then the other days I'll do
Like a squat. Like
I'll
a
do
kettlebell
squats.
squat.
Yeah, yep, kettlebell squats, and then I'll do leg press. Maybe I do leg press on the first day, or I'll do leg press and calf raises, and then I'll do squats on the rack.
Okay. Yeah.
So
And then how many like sets per body group typically?
typically 10 reps. I don't really. I should
10
write.
sets.
No, 3 sets
3 sets.
of 10 reps.
Okay.
And then I should really kind of keep track of how much weight I do. But I'm not too concerned about my legs. I mean, I think naturally we both were pretty like built on the lower body side.
Yeah.
And that doesn't equate to like strength or
so.
health, right? Necessarily. But when I like to wear my pants not too loose. I like to have them form fitting. But when I start pulling them over my thighs, and I'm like, no, I don't think I want to. I don't think I need to do as many squats this week or whatever.
Well, I think that you definitely see these guys who don't work their legs out at all.
Yeah.
We were talking about that the other day.
Yeah.
And just how I think the gym girl like thing now is really like to work out. I talked to a nurse that I work with, and she said, oh, I'm going to the gym. I'm like, oh, is it like leg day today? And she's like, it's leg day every day. I'm like, well, that's probably a little bit too much, but
right.
I think it's important to always, train your upper body as well. I do too. I have 2 upper body days and 1 lower body day.
Oh, okay.
And depending on how my week goes, I might lift 6 days,
Right.
It's usually not. It's usually like 4 to 5 days of lifting. So sometimes I'm hitting that leg day twice in the week.
Yeah. I'll try and be consistent too.
Yeah.
I think even just on that off day when I'm not lifting, I'll just go in and hit the treadmill.
Yeah.
For 45 minutes or an hour, I might do stairs or.
Yeah. I talked to a weight loss patient yesterday, and, she's plateaued on tirzepatide, and her concern was that, the medicine's not working for me anymore. She had some room to go to a higher dose, and so that was my suggestion. But also we talked about she had started HIIT, high intensity, high intensity interval training, HIIT.
I was like, what's the second T?
You're like, but it's all like resistance training, with very short rests in between, maintaining kind of high heart rate. So yeah, there's some cardiovascular idea to that, but I'm like, well, how she's lost 50 pounds on weight loss on GLP. I'm like, where is your, what's your body composition? Like you may actually have gained a bunch of muscle.
Right.
Because you weren't doing this before.
Sure.
So
you're just stepping on the scale, but the scale doesn't explain.
Yeah, it doesn't tell the whole story. I'm like, what do you think your clothes are fitting better? Are your arms getting bigger? Your muscles getting bigger? She's like, well, I haven't really noticed that, but she's like, I had a lot to lose, so it may be kind of hidden under some of the extra skin.
Yeah, like the last time you were this weight, could you put on the same clothes?
Right. So there's not to be understated. I mean, obviously, most gyms now, and my gym has like one of those in body monitors where it uses electrical impedance to calculate body fat and bone, body lean body mass and stuff.
BMI.
Yeah, BMI is just
I guess
that's just
more,
weight and height.
sure. Yeah,
BMI is
that doesn't
probably
tell you
like the
anything.
least useful
Yeah.
metric.
We'll edit that out, so I don't seem dumb.
No, that's
just
important.
kidding.
I think
just
most
joking.
doctors are still using BMI. It's good from a population standpoint, like when
right.
because on average, people who are a certain weight, are going to be obese. That's just our population.
Right. It's a motivator for me too, because if I plug mine in, like I'm 6 feet, 204 pounds or 200 pounds.
Yeah.
Yeah, I'm definitely overweight, according to that.
Right. So,
but if you look at me, you're like that. You wouldn't necessarily say that guy
really someone
needs to go to the gym.
The fact though, and there's so many better metrics than BMI. It's just that it's quick and easy to calculate,
right?
And it's good like in averages for like for a population.
Sure.
It's not useful for an individual person.
Right.
It's just really not. I mean, like most athletes are like in the obese category. Like any football player is going to be pretty much in the obese category because their weight compared to their height, it just puts them in that, or in the very least in the overweight category.
Yeah.
Anybody who works out regularly and has a fair amount of muscle on their body is going to be, so it's not accurate. There are many other better metrics. I mean, even just like a waist to chest circumference ratio, and that has been used for years as well, is much better. You don't need a fancy, like body fat calculator, although that can be useful too. There's a lot of talk about these DEXA scans now, and you can get yourself a DEXA scan. That's supposed to be the gold standard. When I was going through my exercise science, degree, we did, there was underwater weighing was kind of like thought of as a gold standard back then, but that's kind of cumbersome and stuff.
I remember that.
The electrical impedance, a lot of scales, bathroom scales now have an electrical impedance because you just wear bare feet on it and it will, it tends to be inaccurate. Like when compared to these more accurate scientific, but as a metric that you can follow, it's probably it's good.
Oh, that's cool.
So if your body fat says you're 30%, and then you lose 20 pounds, and now it says you're 28%, you've probably actually lost quite a bit of body fat.
Accuracy there, yeah.
And you can calculate that. But to use like just strictly BMI is just not helpful.
Sure.
Yeah.
Interesting. So tying this back into the testosterone thing again, like say for somebody like me who goes to the gym and who's starting testosterone, is there any problem with starting a new like gym routine at the same time that you're doing testosterone? Just in terms of like measuring how effective it is the measuring of the testosterone level, isn't it based on two factors, right? We covered those, I think, the last time, the 4 things.
Yeah, the 4 things was sexual libido, basically.
Right.
Sleep, body composition, and then energy.
Energy, right.
Yeah. So
what would you recommend, I guess, timing wise? Is there anything
if you're, I think that if you need supplementation, you need it, and you're going to feel better whether you go to the gym or not.
Right.
You're gonna get like be better in these areas. It's just that going to the gym is going to like give you an extra boost on body composition. The main things: body composition and strength.
Got it.
Now, depending on how hard you're working out, you may actually feel more tired, while you're recovering, while your body is in recovery mode. But it will actually improve your sleep. Both, working out is going to help improve your sleep, and just being on testosterone will help improve sleep overall. So
nice. Okay.
But if you're like trying to just not change anything, start the TRT and see how different things are, I think that's fine. That'd be a valid, N of 1 experiment. We say N being like the number of subjects in your experiment.
Right.
And if it's just you, N of 1. Sometimes that kind of thing can be the most useful thing. You can read a million studies, but not know how you're going to personally going to react to it. So you
Yeah, you can't discount that, right?
Can't discount that personal experience.
How that works. Yeah, that's pretty cool.
So, yeah. But I think the sooner you get started, the better your results are going to be. You're going to feel pretty good.
Yeah, keep kicking that can down the road a little bit. Because to be completely honest with you, there's a lot of marketing out there about testosterone.
Yeah.
So you have, I'm not going to name the websites. We all know what they are, but you go on them and it seems like they have like a monthly subscription cost, and then on top of that, there's this sort of opaque like cost of testosterone as well, and supplies and things like that. And by the time you're kind of into it, you've done the research, you're like, well, why don't I just talk to my brother who get it for me for, like somebody who knows what my dosage is, he knows my health history.
Yeah.
And to be honest, obviously I'm plugging what you do, but Thunderbird Men's Health, I think the program that we have is actually it makes a lot of sense, right? So we have that initial consult fee and the lab fee, and then it's a pretty low monthly cost.
Yeah, just low monthly cost. It includes the meds. It includes, like, I guess you can call it like support.
Right.
But hi, I'm tech support right here. Like I'm the guy. If you have questions about specific, hey, I have this symptom, is this normal or whatever, or
right.
is this something to worry about? Yeah, you should have access to that kind of medical support. There's a lot of opacity, and frankly, like a lot of these walk-in clinics and stuff that you go in and pay by the week, it ends up being quite expensive.
Right.
Now, there's something to be said for quality of what you're getting too. You can have a primary doctor that just prescribes this stuff for you. You're going to get like a pretty generic commercial formulation. Usually has to be injected intramuscularly. It isn't going to work in a sub-Q injection.
You mean like in the shoulder and in the arm?
It has to go in the muscle, like directly into the muscle. That would be like your grapeseed oil, testosterone cypionate. If you're doing an injection, if you're doing like a cream or a paste, which I generally don't love, but if injected, test cypionate, grapeseed oil, just your commercial stuff that you get from the local pharmacy, Walgreens or CVS, that's going to be injected right into the muscle. Now, the formulation I like to use for most patients is a testosterone cypionate, but it's an MCT oil product. It's a much thinner product. And it can be injected subcutaneously.
Okay.
We have studies now that show similar absorption rate, perhaps hours versus minutes, but that over the course of like a weekly injection isn't going to affect things. And metabolism's the same. Everything else is pretty much the same. So, and it's just an easier injection. A subcutaneous injection can be just into the fat of the belly or the arm or something like that, as opposed to a large muscle of the body.
Okay.
Even though we've gotten pretty strategic about where to inject. I think most guys like to inject in the thigh if they're doing it themselves. If someone else is doing it for them, the glute. Personally, I like to inject into the rear delt, the back of my shoulder.
Oh wow! You can reach back there.
I use the towel rack in my bathroom. Rest my arm on there, but the rear delt for whatever reason is very
sort of not immobile, but
yeah, it just doesn't have as many nerve fibers. So
does it really? Oh wow! Yeah. I've been working.
I barely feel it.
Oh yeah, that's true. I guess if you feel, no.
I don't know.
Interesting.
Works for me.
Yeah, that's what you're used to, right?
So I have this friend who's a former IFBB bodybuilder who's done a lot of self-injecting, and that's where he basically made that recommendation to me.
Location of choice there.
Yeah.
Location of choice. That's kind of cool. Nice.
Yeah. So we got to get you started. Get you working on that body composition. Get you feeling better. I think. I have patients who are on weight loss meds and testosterone. I think if you're going to start fresh, probably want to supplement the TRT first and see how your body reacts to that.
Yeah.
you're very likely to lose some weight just with that because of the increased activity and effects
Right.
in the gym and stuff.
Right. Yep. Cool. Looking forward to that. Just looking at our notes here, some of the questions that I think we kind of touched on this a little bit last week, but for those of the folks who haven't listened to our first podcast, so how does somebody get started on TRT?
Yeah. So we start with a consult, and we just go through those kind of 4 general areas to determine if you are actually having symptoms. The age doesn't matter. I have patients in their 20s who are starting to feel effects, or just trying to really optimize things, all the way up to octogenarians and stuff. But it's we go through the areas, talk about what your goals are, and what you're hoping to experience. Then we go to labs. We need labs, blood work. It's a full panel: testosterone, estrogen. Looking at the lipid panel, which would be cholesterol, triglycerides, and then check the CBC. That's the blood count. Sometimes you can have an increased hematocrit, which means increased hemoglobin and basically blood cell content of the blood that can result elevated. It can be elevated in patients who supplement TRT. So if you're starting with that, a condition called hemochromatosis, then you may want to alter dosing or even consider therapeutic phlebotomy, which would be like donating blood.
Oh, I see.
Yeah. So that's pretty much it. So that's kind of later on. The initial consult is really just an exam and a discussion with the doctor.
Got it. That's cool.
A 20-minute consult, depending on your medical history and what else you have going on.
Cool.
Obviously, we have some other things that we'll sometimes talk about. One of the metabolites of testosterone contributes to male pattern baldness. So we can use topical finasteride, which is a testosterone blocker essentially at the hair, in combination with minoxidil and some other like vitamin E and some other products that can really help limit the male pattern baldness. In some cases, even regrow some hair that you've lost. So that's one of the benefits of working with somebody who does a lot of this.